Okay, I think it's recording now.
Okay. Good morning. Welcome to the May 14th, 2021 meeting of the Needham Board of Health. I'm Rob Partridge, Chair of the Needham Board of Health. This open meeting of the Board of Health is being conducted remotely per the Governor's Executive Order of March 12th, 2020 due to the COVID-19 pandemic emergency and is being recorded. Public access to this meeting does not ensure that there will be public participation unless required by law. Public comment at this meeting is not anticipated. I'll introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Kathleen Brown?
Yes.
Ed Cosgrove?
Yes.
Steve Epstein? Christina Matthew?
Yes.
We have Steve. Steve, are you there?
I am now. I just needed to be promoted. Thanks.
Okay, now just say yes.
Yes.
Okay. And Dawn Stiller?
Yes.
Tiffany Zeich?
Yes.
Tara Gurge?
Yes.
Carol Reed?
Yes.
Hannah Whitehead?
Yeah.
Karen Shannon?
Yes.
And Mary Ann Donnell?
You might be muted, Marianne.
All right, and I think that's everybody here. So the first item on the agenda is the meeting minutes from April 16th. And I had only one comment, and that was that it said there were 3 cases of babesiosis and 4 cases of Lyme disease. I think it should say 3 cases of Campylobacter related to food consumption.
Okay, I'll write that down, make that change.
That just needs to be corrected.
And the only other correction I had was when we talked about the ventilation system at that restaurant, we used the phrase they installed a filtration system, which is not the case. They did I would call it change filtration to ionization. Sorry, I'm just trying to find the page. Oh, it's page 5, 1, 2, third paragraph down. They say air purifying filter system. Just make it, remove air purifying filter and just put with ionization system.
Okay, I make that.
Me. Thank you.
Other comments? Okay, I guess motion to accept.
So moved.
Second.
Okay, and we'll vote. And Kathleen,
Yes.
Ed,
Yes.
Christina,
Yes.
Steve,
Yes.
and Rob's yes. Okay, so that's that dealt with. Okay, so we're up to staff reports, and I think starting is environmental health. So Tara?
All
Do
right.
you want me to share the screen with all that? Would you like me to put that up there?
I think we're good. So basically, I can give you a couple highlights, and if you have questions. So Diana is on vacation today, so we basically have been doing business as usual, just keeping up with the concerns that have come across. Again, the COVID complaints are still down, so that's good. The well regs again have to get pushed off till next month because Sean Harrington was slammed this past month with water and sewer issues. Bumped it up to June, so hopefully we'll be able to have that draft well reg review next month. The other item we wanted to report is the student intern position we went out for. The posting ended the end of last month. We had a great pool of applicants. We had like 28 come in. So we were really, we're happy about that. We're actually in the process of whittling down to a good pool of candidates for interviews. So we'll be interviewing for that job hopefully in the next couple of weeks. Start in June, is what we're hoping, the end of June maybe, which is perfect timing for a farmer's market. So we're hoping that will be good. And other things here, the pool, again, we've been having Zoom calls with Stacy. We met Fabian online. I also met him in person, the new assistant director of Park and Rec. So we brought him up to speed on where we're at with the pool protocols for COVID. And so we're going to go forward with that mid-June. They're looking to open up the pools. The other updates here, St. Mary's. So the two properties on St. Mary's that we're watching, we're working with the owners on those properties. The long-term one that we've been working with has been doing great progress. Building commissioner is very happy with the things that he's removing there. So we've made more progress there than ever. So we're going to keep that up. I'm supposed to be meeting with him today. When we meet with him, it gives him incentive to keep doing it. So we stop by, we meet with him, we chat, he shows us what he's removed. And so we keeps up the good work with that. The property across the street from there, they are getting a dumpster and he's just gonna throw everything in the dumpster and get it all removed. So we have two good progress reports on those properties on St. Mary's. So we hope that will keep going forward. And then the other item I wanted to review is the Blue and Highland HVAC item. So we were able to reach back with the HVAC company that did the ionization filter upgrade that they did on site, and we talked to them about the air exchanges. They do currently now meet the 3 air exchange, but they also said that the filters and the ionization add to that, and the fact that they can open the windows also increases the airflow. So that's basically what they've reported to us right now as far as their air changeover rates. So I don't know if that seems to be, that would satisfy the board, or if you need us to get any more information on that.
Do you know what kind of MERV rating they have on their filter? I mean,
I can get that from him. So he's reaching back in touch with me today with a summary. So I can make sure that that's in his summary. He was going to get it to me this morning, but I can find out exactly what the rating is if you want me to find out.
I mean, that's kind of, people are shooting for MERV 13, but
Okay.
With the windows open as much as possible and the high vaccination rates and the cases coming down, I think it's, I don't know.
Yeah. That's
Thank
what we agree on that. And he got all the plexiglass barriers up where they were going to be put. And so he's done that. So he's really been working with us on all these other items. So I can get that to you.
Likewise, Tara, I think you said, 3 exchanges. I think people are shooting for 4 to 5, but is 3 kind of the standard?
So I've read all different. So I read an article and I just sent it to Diana yesterday that I've seen 6 as a goal too. But that would entail, basically upgrading it. Again, they'd have to increase that. And the other thing you got to keep in mind is that once they increase that outdoor air, when the summer comes and they got to put the AC on, the costs that will entail with heating that, that hot air, cooling that hot air coming in would be a great cost. So we have to kind of balance that out as far as that's concerned. But I'm thinking the fact that they did upgrade their filtration and that they have the ability to open the windows. I know they're probably not going to open them if it's like 90 degrees out, but it does add to that number. You know what I mean? So there's no, I've read all different numbers of the set standard for that. So.
Okay, thank you.
Okay, so I think that's all we wanted to report on our end, unless you have any other questions.
I did have one question. And what is Burger Food Safety?
Burger Food Safety is the consulting company that we work with that actually we have our electronic food inspection program. She developed it. And she's been training us in ServSafe. Like she's trained, Needham Health Department staff. We found her way back when I first started. She's been excellent. I mean, she basically has trained us really well, gives us these consulting services now. And then we do the electronic program with her for the food inspections. So we've known her for many years, so.
Got it. Okay.
I just had a quick question about farmers market. And now that we have all these prepared foods and public consumption in the park, like, are they allowed to sell prepared foods there? We always had this bathroom issue.
Yeah. Yes. We're keeping it no sampling this year. We're going to keep that requirement and so they can sell prepackaged foods, but they have to be under refrigeration or on ice. So the little change this year is that we're allowing the ice, but no sampling is allowed this year.
Right, but they weren't allowed to sell sandwiches. They could sell everything else.
Right.
Now they can they do sandwiches again?
I don't think we have a sandwich vendor. I can check with Diane on that. I know one year they were allowed to sell, but not open. I'm trying to think if I don't think we ever allowed open food. They were maybe prepackaged.
Okay.
Is that-
Just there was that whole bathroom issue and whatever.
Right.
Wanted to
We
be able
haven't
to
been,
get a place.
we haven't been approached by any vendors to sell any open food, but we would say the same thing. No open food, no sampling. Yeah, we would stick with that.
Thanks.
I have a question. Have we had any issues with the eating and drinking on the common relative to use of bathrooms? Or are the local restaurants allowing people who are eating on the common to use their bathrooms?
We haven't heard any issues with that. This is, so usually if there was an issue, we would probably get a call about it. So yeah, I haven't heard anything with that. So.
Okay. Just something to watch.
Yeah, because it's getting more and more popular. So,
Yeah.
okay. Thank you.
Okay, thank you. Any other questions on environmental health? Okay, moving on to public health nursing. Tiffany?
Yes, thank you. Both my nurses are out this morning, so it will just be me. For the month of April, we continue our communicable disease investigation, but have gone down significantly, which is awesome. So we started our homebound vaccine distribution. We think, as most of you guys know, we're going to do J&J, and then they said no, on hold. So we did the Moderna, and then the day after we got the Moderna, J&J was approved. So we decided to use the J&J instead. And we only, by the time that was all put together, we only ended up doing 20 homebound vaccines. Of our list of about 55 people we had on there, only 20 of them needed them at that point. So we do have a few J&J left that we are outreaching to other communities, other different groups to try to see if we can do that. And then we were contacted by the state because they were going to come pick up the Moderna, and they didn't have anybody to come pick up the Moderna. So now we also have the Moderna that we are trying to utilize. We held a clinic Wednesday, but it didn't get much foot traffic. So we're going to try to do some evening hours next week, but it's Moderna, so we can only do the 18 and older. So we'll continue to do that and hopefully get some more vaccines done. And then they promoted the COVID vaccine survey. We're grateful for all the community partners that helped us with that. We got about 210 results back. So Hannah and one of our contact tracing staff members, Jessica Fuchs, will start working on looking at that information. We didn't get a ton of people who returned it that hadn't received the vaccine. And only, I think it was about 25 hadn't received the vaccine, but only about 15 said they wouldn't receive the vaccine. So it's a very low subset of numbers. It kind of tracks with what we're seeing in Needham as a whole. So hopefully we can look at that and see why. And then DVAC did a Mother's Day drive this last month. I believe they started it in April and went through Mother's Day to do the baskets. Not sure exactly what the outcome was of that, but I know they were putting a lot of effort into that. So a couple of things. We'll get into the COVID with the COVID update report. I know last month Hannah presented the TB cases that we had and was able to get a answer from the state that none of them were active TB. They were all latent TB. So they have been put into the latent section. Even the one we had back in February was latent as well. So we are not having to do any information on that. They just notify us that there is, those are here in Needham. So they're all being tracked by the state within other things. And then they are, thankfully, I just heard yesterday, putting up a TB training for public health nurses that will be able to be accessed, because it seems to be going in all different directions, I feel, sometimes from the state. So whenever you get a TB case, it's different depending on who you talk to. So, so that will be helpful to have something a little more standardized. And then nothing
Good
else
question about the TB. Did they get taken off the list? It still
So
says
they go down to the latent. They weren't revoked. So they're down at the latent TB after the tuberculosis section. So they're just down there. Yeah, I think that's it on that. No animal bites, which is great, knock on wood. And then, yeah, we just continue with everything else. One thing I would like to point out is our gift of warmth and the amount of donations that we have done this year comparative to the last 2 years. We have doubled from fiscal year 19, and then last year we didn't do much, or fiscal year 20 we didn't do much at all. So this year we've done close to $13,000 worth of gift of warmth donations, and we are very grateful for the community council for their help in all of that, and all the different community members, and a lot of the churches in Needham have also donated. So we're grateful for that because we continue to see concerns and questions from the residents on that. And that's it for nursing. I'll kind of just flow right into emergency management because Talib is also not here today. So as we kind of wind down any large scale vaccine clinics, we're working on restocking and reorganizing the trailer and making sure that it's up to standard for future years and what we need to do with that. So Talib's working hard on that. And then we're also working on an MRC monthly schedule for trainings to keep our volunteers engaged and interested in helping public health. So those are those two.
All right, great, thank you.
Tiffany, can I ask a quick question about the survey that was administered?
Sure.
Is that something that you all wrote?
Yeah, so we had one of our nursing students wrote it up through just a Google form. So it was pushed out electronically through a couple different groups, and then we printed them and took them to Housing Authority, and then went back and picked them up last week.
And what kinds of questions were on there?
Questions, the first, it was a survey where if you answered one question, it prompts to the next one. And if it was a yes, I got vaccinated, then that was kind of the end of the question, end of the survey for you. If it was a no, I didn't get vaccinated, then it went to why, do you anticipate getting vaccinated? Trying to think of the other questions. Do you anticipate getting vaccinated? If it was a no, what are the reasons? There were several different reasons, or I think there was a possibility to write in the reason of why you didn't get vaccinated, something like that. We'll have more at the next, the goal is to have it for the COVID update in 2 weeks. So I'll be able to have
How many people, do you know how many people have completed it?
Yeah, we had 210 people that filled it out.
Okay.
So,
Was that, yeah, I'm just wondering why there was kind of like a targeted outreach rather than like, why not, share it even more widely to the community?
So we spoke to Cindy, the PIO, and the idea was to not send it out as a town because we wouldn't necessarily reach the same people that would be interested in our COVID stuff. It's not necessarily the same people that would be interested in getting the vaccine. And so we pushed it out to different groups instead of like posting it on the town website and things like that, or sending it via email.
Tiffany?
Yeah.
Different question. Teenage vaccines. I know the schools have set up a clinic. I heard all those slots went in about 20 minutes. Since we have an ultra cold freezer, is there any hope that we might get some Pfizer and be able to vaccinate some of the teenagers in town?
No, at least not yet. The state has a meeting with Tim and a lot of the other health directors on Thursdays, and they just keep telling them that they're not changing their distribution link for the vaccine right now. So it doesn't look like we will be getting any. They were approached by PelMed, which is a private private pharmacy, that asked if they wanted to do that. So the schools decided to take that on, but they did fill very quickly. I think they were going to try to open up another one on Sunday if they could get enough people to work, but I'm not sure if it happened or not. I also did get approached by Needham Pediatric because they have the ability to order some too. So we may allow them to utilize our ultra cold so that then they can do the vaccine for their patrons. So
Okay, thank you.
you're welcome.
Great, thank you. Why don't we move on to traveling meals? Marianne?
Hi. Hello, can you hear me?
We can, yeah.
Thank you. So as every month, the program is moving along. Summer help the volunteers will stop working the week, I think, of June 21st, and the summer staff will take over. Same for women that worked last summer are returning this year, so that's excellent. And we're still waiting for applicants to come in for 2 subs for the program. And that's it. Any questions? No? Okay. I'm done. Thank you.
Great, thank you.
Thank you. You're welcome.
Fantastic, okay. Substance use prevention? Karen?
Sure. Good morning. The month of April was a busy one for our prevention group and the SPAN Coalition. We had a number of events. One included the tipping point when youth use becomes addiction. We partnered with the Natick Public Health Department and their coalition, which is Natick 180, to host a panel event for community members in both Needham and Natick, where we had the principal of the North Shore Recovery High School, Michelle Lipinski, who you may have heard about. She also has been featured on a TV show called 16 and Recovering. But it was a panel intended to provide attendees with signs and symptoms of more concerning substance use among youth and how to navigate that process for your child. We had a parent panelist as well, and we had a young man in recovery. So it was a diverse perspective for offering information to community members who may have concerns over their own child and their substance use. So we were pleased to provide that to the community. The other event we had was the DEA prescription drug take back on April 24th. And we had a great opportunity to do a drive-through event up at the town hall using Garrity Way. We collected just under 100 pounds that day alone. And we submitted 290 pounds for the 6-month period from last October to April that was turned over for the incineration process. So pleased to partner with the police department on that. And we also had a number of SALSA students who came back to volunteer with us. And Denise Garlick, Representative Garlick, came by as well to support our efforts. From a SALSA perspective, I'm pleased to also report that we had 2 members of the SALSA program meet with representatives from Representative Jake Auchincloss's office last month. And their purpose was to advocate for the federal ban on flavored tobacco products. So we were very, very impressed with our students' presentation. They were well prepared, and they met with 3 members from Representative Auchincloss's office. And it's a result, I think, too, of the hard work that they're doing around policy, advocacy, and learning more about that as young people and how they can make their voices heard. So we're pleased with that. We've been doing focus groups this spring. We had a focus group for parents of Needham High School last month. We're hoping to do another one this month. We'll have consultant who we've hired, SSRE, help us with that report once the groups are done. And then finally, we had some training for our SPAN members. We brought in the Montana Institute to provide a 2-hour session on the introduction to the science of the positive and positive community norms, attempt to build the skills in our group, in our coalition, message development around youth substance use prevention using the tactic of positive community norms as opposed to the opposite, which is more of the negative and some more on the scare tactic end of promotion. We're looking to capitalize on positive community norms to close the gap between the perception of how much use there is in the community among youth. And then lastly, our vaping grant is moving along, and we submitted a recommendation to the high school administration on their vaping diversion program. They had asked for us to do a review of the program, and our grant coordinator, Angie McDonald, did a tremendous amount of research and then submitted some recommendations on how to use best practices for diversion in that regard. So that's everything I have.
That's quite a bit. I have a question. Has the board ever sent a letter to the students or the groups that you work with just to commend them on the work that they're doing and thank them?
I don't believe so, but I think that's a terrific idea.
I don't know what other board members think about that, but I think, some positive support for all the really good things they're doing.
I think that's a terrific idea. We need to do that.
Yeah, I
I think
almost
that-
wondered, it would be great to have some sort of, because there are so many involved high schoolers. I think it would be great to have some sort of, even like a youth award or something that, for public health.
I think we did do that actually 3 or 4 years ago. Somebody would have to kind of check on that, but it's not a bad idea to do it even annually.
Yeah.
And it's a good
I
time
think that's
at the end of the year.
Because it's a whole new group of people every year.
That would be wonderful. I might add that during the pandemic, their community service hours is up over 50% from last year. So as of today, I think they have over 1,300 hours collectively among the students for community service this year. 1,300 hours.
It's impressive.
So yes, be happy to talk with anyone more about acknowledging their efforts.
Okay. We will do that. But for the moment, I will move on. I think Lynn is not here. So we're going to move on to SAPSI. Carol?
Hi, it's nice to see everyone. Let's see. It's a lot of end of fiscal year through BSAS funding spend down, and we are working as our last initiative for our strategic plan to create a community awareness poster, specifically talking to youth, young, upstream prevention about alcohol. And I have been collaborating with Karen and Aubrey and Norwood and Chrissy and Dedham. Westwood at this point doesn't really have the capacity to have anyone engaged in prevention. We're hoping that changes. Anyway, so our final year 6 funding for my position in that regional work ends June 30th, and we are moving forward to get some police officers recertified as TIPS trainers to be able to conduct TIPS again for our alcohol licensees across the 4 towns as we've done before, as well as complete this alcohol talking to your youth poster and put it up hard copy and disseminate it through social media. Otherwise, I've just continued to maintain a connection with the work that our new law enforcement social worker is doing with CCIT, trying to expand resources and access for homeless with the Norwood Hospital closing. The police have had issues that Stephen most likely knows with people that are homeless and at the hospital, and also just trying to be more aware of what is local for people for substance use. Actually, we went to visit a new program that we didn't even know was there. Greater Boston Addiction, I included that in my report. And we met with the people there. They've got recovery, treatment, detox, and there's a website if anyone wanted to see it. I didn't realize, I went with Kim and Dave Forte, one of the police officers, that it had been open for a few months in Needham. So just trying to also be an advocate for public health and the FY22 budget with Rep. Garlick's amendment, and coordinating the resubmission of our Mass Call 3 grant, which will fund me, if approved, that was not able to be accepted last November because the state system combis failed. So I worked with Tiffany and we did submit the other day, May 9th, and we tweaked the narrative, and hopefully it will be approved in the communities that we will collaborate. If so, are Westwood, Dedham, and this time Walpole Public Health. And the work that Tiffany and Tim do with the NC8 region is really powerful. And this work is welcome to Westwood and Walpole, who really don't have prevention capacity. And my goal would be, as we did with Dedham and Norwood, to get them the federal drug-free communities grant so they can hire their own prevention staff. But I also wanted to thank Tiffany. You know, I'm on the Medfield Board of Health, and she has really worked diligently to offer to Medfield and Dover vaccinations for homebound, welcoming people to the clinic on Wednesday, and communities like ours who have zero public health capacity right now. We don't have a nurse. We really appreciate it, and we really appreciate Needham and the efforts that they've done. Have not gone unrecognized in Dover and Medfield, and I appreciate it. Thanks.
Great. Thank you. Questions from the board for Carol?
I just was wondering, do we, you know, like with the pandemic, alcohol consumption is way up. Like, do we think about like adult outreach on, you know, maybe not everyone has like a extreme drinking problem, but maybe they can cut back. And I think of that as like an education program. I don't know, something like along those lines, let alone the healthy eating, obesity kind of stuff. You know, everyone's gained weight and they're drinking too much. So thinking about
the data is there, and I appreciate that. I work with a group around the state, and David Jernigan now, who's over at BU, and we meet once a month at night. And although it aligns with our funder, people are particular about working on policies sometimes. However, the relaxed regulations have certainly contributed to increased access. And then we talk about the competing demand of promoting businesses and more licenses for restaurants to come into communities. So you are all experts. So the data is there, especially with women, on increased drinking, you know, social isolation and stress. So yes, and I know through Tiffany and Karen, they have a commitment to enhance the education and outreach for across the lifespan on all ages and the health harms. You know, for years, I've been grateful because I've been to Washington Forums. In the UK, they have an amazing initiative about informing people of the cancer risks and the data with breast cancer and the, you know, 4 other organ cancer increases. But the industry in the United States is so powerful. We don't have the same commitment to talking about the health harms of alcohol. And that's hard for me personally. But drinkaware.uk is amazing. And so we in our small group, now that David's here and Tim Nami has been here, is saying, how can we talk about what's happening with COVID and more licenses and increasing access, but also inform people that the health harms and impact that have been squashed here primarily.
Yeah, like lower alcohol and things like that is a big thing in the UK. I mean, they don't want to change it. I understand the social. Anyway, I don't want to get into policy, but anyway, it's an important goal, I think, something to think about. So thank you for looking into it.
Well, it's like swimming upstream. But I know Tiffany and Karen are committed to expanding and creating more awareness. Someone like me wants to change policies, of course, and which not always favorable. You know, one of the things, and I promise I'll stop after this, we do a lot of delivery And we've talked about this for years in Needham and our SAPSI towns. Are they monitoring delivery records? Tara does an amazing job. She looks through tobacco at the paperwork twice a year. It'd be great if we could go into the liquor stores and not to impede anyone's business model, but just to ensure that they are delivering to people and have a signature of 21 and older. And, you know, there are certain particular strategies we could focus on that to me wouldn't hurt anyone's business. It would just allow us to collaborate to have safer, more structured protocols that ensure, you know, limiting access to alcohol. And over the years, I've always said we've had people in my work at NORCAP and Norwood, multiple deliveries and multiple sales a day to people that have chronic alcohol. I found that it encourages businesses perhaps to limit their sales to people that are above age, but, you know, obviously are struggling. And I've seen liquor stores in different towns, you know, hand out a card or say, you know, twice a day is our limit. So you can tell I could talk about different things for a long time. Sorry.
That's okay. It's good stuff. Thank you, Carol.
You're welcome.
Okay, let's move on to our COVID monthly report from Hannah.
Okay, great. Can everyone hear me?
Yes.
Okay, I will keep it brief since I think we're running a little behind schedule. But yeah, so in April, our cases went down by almost 50% compared to March. So we had a total of 103 confirmed COVID cases, and you can see even within April, we're seeing a decline. So yeah, it's great. Cases are going down pretty sharply. Looking at the demographics, April skewed a little bit more male for some reason, and as we've been seeing, the cases are mostly in the younger age groups now with vaccination. So just overall throughout the whole pandemic, you can see just how kind of sharp the last few months in terms of decline have been. And when you look at the kind of cumulative line, it is really starting to kind of flatline a bit, which is great. Again, by age, decreases across all age groups, almost no cases in the over 65 group. I think we had one confirmed case in April. And even in the 5 to 18 age range, we're seeing a decline. Same thing, incidence is going down across every age group except for the under 5, which went up a little bit. But other than that, steady decline. We can skip that one, I think. Yeah, so as we've been seeing, the cases are concentrated in the 5 to 19 and the under 5s a bit, as well as 20 to 34. When you look at the older age groups, I think it's great, especially 65 plus, there's basically no cases. So yeah, we can see it's concentrated within the youth in 5 to 9, 10 to 14, and then 20 to 24, with the biggest gap in the 20 to 24 compared to their population size. I think that this may be due to just some issues with the census data that we work off of. I think with COVID, there's probably a lot more 20 to 24-year-olds at home than normal, so that could be kind of skewing that a bit. And that, I think, is reflected here when you see that the 20 to 24 age group has a much higher incidence than all of the other age groups, but again, kind of taking out that anomaly above average in the youth, and then kind of sharp declines as we go into the older age groups. So looking at COVID testing and our positivity rate, which has also been steadily declining since the beginning of March. And you can see the number of tests we have had done in the town has stayed pretty constant. So to me, that indicates that it's a true decline in the positivity rates, not just an artifact of increased testing. So we've started looking at the symptomatic proportion of cases. As you can see by the yellow bars, we still have a good amount of cases that we just don't have data on because we're not able to get in touch with them. But the percentage of symptomatic cases does increase with age generally, which we would expect. So I think probably a point of big interest right now is kind of thinking about the variants and reinfections. We do now have some data available on this through the state. So to date, we have 5 cases in Needham that were identified as variants of concern. So they will sequence cases sometimes randomly, and then also for suspected breakthrough or reinfections, sometimes those get referred up to get sequenced. So those variants are definitely circulating in Needham, more so the B117 variant. And then the contact tracing team has done a great push over the last couple of weeks to look into reinfections in the town. And so this is something we are seeing a little bit of. I think there was one more case flagged in the last couple of days. So we seem to be at about 12 reinfections. We're seeing on average, there's about 5 months between when we're seeing a first positive case and then a second reinfection, but a wide range. And then another thing that I think will be very important to track moving forward is breakthrough infections as we see, more of the town vaccinated. And we have seen 3 of these infections so far, or in April.
Can I just ask for a point of clarification on the reinfections? The issue with Maven that we discussed at our last meeting is that we don't get a notice, right, of that reinfection. It's because there are a prior case. And is that indefinite? Like if it was a year, 6 months later, would we get a notice? Or not ever, as far as we know.
Okay.
No, go ahead, Tiffany.
I was just going to say, my understanding from when Mary had emailed them was that it would be outside of a year, we'd get re-notified, but anything within a year, we wouldn't. So, so if somebody were positive last March, we should get a new notification, but I'm clear on that.
Yeah, so hopefully that will be changed in the system soon to identify these 11 reinfections. The contact tracing team went through basically every single case and checked whether they tested positive a second time later on. So a big thank you to the team for going through that. Clusters, we saw a lot fewer clusters in April. No, one congregate care cluster, but the one case was not, I think it was a staff member, so it wasn't even a Needham case. More than half of the cases we're seeing can be linked to a household cluster. So that's definitely where a lot of our transmission is going on. So just looking at the household clusters a bit more, they are on the smaller side. Most household clusters are just 2 cases or sometimes 3, with a range up to 5. And the age distribution, again, like we looked at last month, I think kind of shows a clustering around, children's age and then typically parents, which makes sense. Contacts, so there were 55 contacts recorded in Maven this month and then 84 through the public schools. So turning towards vaccine coverage, which continues to increase pretty steadily. So according to the state, as of last week, as of the 6th, almost 3/4 of the town has received at least 1 dose and over 50% are fully vaccinated. So that's great. And just looking at kind of how our COVID incidence maps onto the vaccine coverage, you can see as vaccine coverage continues to steadily go up, the cases have really kind of sharply taken a turn downwards over the past month, around when we hit, let's see, about 75% of the town vaccinated with at least one dose. So looking by age, can see that in the adult population, almost everyone has received at least one dose. Obviously in the 0 to 19 age group, it's much lower because most of them are not even eligible yet. And then when we break that down into whether they are fully or partially vaccinated, as we would expect, the fully vaccinated proportion increases with age, but even in our 20 to 29-year-old age group, it's over 50% are fully vaccinated. So this is looking by race and ethnicity. I think if we can actually skip to the next slide, I think that one is a bit more helpful. So this is looking at by racial and ethnic group. Among those who have been vaccinated, what proportion are fully versus partially vaccinated? So you can see among the white population, it is quite a bit higher, the proportion that have received both doses. Again, I think we talked about last month, we don't have kind of age breakdown by race and ethnicity. So this could be kind of just the result of different age structures within each race and ethnic group. So just looking at the number and proportion of our town that are fully vaccinated by race and ethnicity, as we would expect, over 80% white, but we are seeing steady increases across all of the groups. And then just kind of taking a look at our progress compared to the statewide averages in terms of the proportions that are fully vaccinated. You can see Needham is definitely outpacing the state. Yeah. And similarly, compared to our kind of neighboring towns, Needham has a lot of resources and a lot of residents who likely had earlier access to the vaccine. And we are seeing this kind of across age groups. We are outpacing or similar to Newton in most age groups. And really notably in the 20 to 29-year-old age group, we seem to have a much higher proportion. And the last slide, just circling back to vaccines distributed by the town, as Tiffany talked about earlier, with the homebound vaccinations, this has been climbing again a little bit. It's a bit hard to see on this graph, but if you do look at the numbers for the last few months or few weeks, that captures the additional 20 people who have been vaccinated through the homebound program. And this will, I think, go up a bit more with the Moderna clinic that we had this week.
Great to have so much good news.
Yes,
In
very
such a long
promising.
time. Do board members have questions for Hannah about the data?
Sorry, one more follow-up. Do we not do contact tracing then on reinfections? I know I'm like, so nothing happens with them?
At this point, if it's past 14 days, there's no point. So no.
Yeah.
I don't think any of the reinfections that they are aware of from looking through were within the last month even. So.
Right.
All right, great. Thank you, Hannah. So the next items, I guess the first one is the Health and Human Services draft policy on racial and health equity. So we can discuss it and make edits. Tara or Tiffany, do you have things you want to lead off with about this?
Lynn was really going to lead off on this, so she's not able to be here. I think really we're just wanting to know thoughts on what the process is that's written down in here and what you guys think, if there should be anything more added to it comparative to what's in there.
I guess one thing I thought was just to be sort of consistent. Like if looking under the purpose, you know, we talk about, you know, different groups that, you know, might be subject to health disparities based on race and other things. But then under the policy, it lists like it's a different list. You know, so we talk about age and under purpose, but we don't talk about age under policy. At the last meeting, Steve also mentioned creed. So that would be something that we could consider.
I'd also like to see some data in here in purpose. You know, I think we have a lot of good health disparities data.
I did a draft if you, I mean, I could actually share this with everybody if you want, if I can share the screen.
Yeah, let me add that in there. Okay, so you should be able to now.
Everybody see it?
Mhm.
Yep.
So what I did here largely, what, you know, and we can discuss it as a board, obviously, but I try to keep the editorial comments to a minimum because it doesn't serve anybody to be inflammatory where that happens if it's not going to change what we're actually going to do. So I tried to keep what we're actually going to do pretty much the same, but you can see that I think I've got the laundry list here and corrected some of the issues as well with some of the phrasing. You know, it's gender identity these days, sex and gender identity, and I tried to match the lists as well. So you could take a look at these, but we've got, you know, I think that's the laundry list. And that's echoed in the next section down here as well.
Great, that's exactly what I was talking about.
And then as far as procedure, I did change this first one here. The initial language said, you know, a particular emphasis on, and, you know, again, I think this is more semantics than anything. Clearly, the purpose of this policy is to call attention to racial inequities, but I think we need to be careful not to say that we're going to prioritize racial inequities over all of these other inequities. I think there's an intention and mindfulness that needs to be placed on that. So this is my first cut at, you know, in trying to address that while giving, you know, while calling it out explicitly, without prioritizing that over other inequities that we also need to be mindful of as a Board of Health. So I don't know if this kind of hit the mark, but I'll throw it out there as, you know, an edit and, you know, a draft, and people are welcome to play around with it. And I can certainly forward this to Tiffany and the rest of the staff, Tiffany and Tara and Tim, to distribute if people are interested.
Yeah, I mean, I think we probably all like to review it and add our own edits and comments.
Yeah, if you want to sit down, we'll make sure to push it out. That'd be great.
Very good. I'll stop sharing the screen then at this point. If I can. There we go.
And there's one word in there that says when we talk about class, I just kind of wondered, exactly what that means. Are we talking about like socioeconomic status? Are we talking about homelessness or?
Yeah, that was in the original. I just left it there, but I agree with you, Rob. I'd like to see some clarity as to what that means. Maybe socioeconomic status would be a better phrase there.
Okay, well, we can work on that when we do the edits.
Yeah.
All right, thank you for that. That looks like a really good first pass. Other comments from board members about the health and equity document? All right, great. So the next item is the Nuari vision statement, guiding principles and intentional practices. So this may result in a lot of discussion, but I think we can at least get started on it. This is a big project, and will take a lot of time to implement. Christina, you had a lot of thoughts about this, and how our board might want to approach it, and I was wondering if you wouldn't mind starting off the discussion on this.
Sure. I mean, I think this is really great work. I'm so thrilled to see that the town is moving in this direction. I think when we look at the principles and practices, there's a lot in there. And I think I said this last week that I feel like, personally, I can get behind. Hello?
I can hear you.
Okay. There's an echo. No, well, I'll try to go ahead. But anyways, I feel like personally, I can get behind all this. I think as a board, when I read through all of the things that it's asking of us, and HHS, it feels like I'm not sure that we can commit to all of these things and that we can actually carry them out. And I think part of my challenge with this whole thing was that, which is why I really advocated for someone from our group to be at the table, is that I worried this would happen, that we'd get to this point and, the planning committee, all these other boards and committees that probably should have been at the table weren't there. And now we're being asked to adopt or endorse these principles and practices. And, at some point we'll be held accountable for, if we do that, for doing this work. And I just worry that, there's a lot. And, if we do take this on, how will we carry this out? How will we measure this work? How will we be intentional in how will we do this? My feeling was that, I think we could kind of commend the work that the town has done in moving this along, the work of Nuari. But that, we once again try to advocate for us to be at the table, us meaning, Tim, anyone from public health, to be at the table, to engage in these discussions and really think about how we're going to do this work. And I know Nuari is they're adding some folks to the group. So I think this would be a good time for us to maybe consider advocating for public health because we are notably missing when you look at the housing, public safety, schools, we're not there. So, and I think there is a place for us. And even when we look at, if we're really looking at racial equity, we don't have a ton of data. And Rob, we had kind of spoken a little bit about this, that at the last Nuari meeting, Mary Lammy, the assistant superintendent, presented to Nuari about it was bullying and verbal harassment data, broken up by race. And what is that? And so one of the, she found that, and it was using the Metro West Adolescent Health Survey. So 42% of Black students are bullied in middle school, 30% of Hispanic kids in high school. These are just kind of the highlights, verbal harassment in middle school, 20% of Asian kids are verbally harassed, 29% of Black. In high school, 40% of Asian kids report being verbally harassed, 25% of Black kids, 26% Hispanic. And so then I was wondering, how does this translate to, because the town offers, therapy and counseling services, how does this, do these findings kind of translate to who's accessing the services that we offer? So that's one place I thought, well, we could really have impact there. We just need to take some time to review this. I talked to Sarah Shine yesterday, and she said that in the system currently, they don't, code each student that accesses their services by race. But she said we could at least for the last year look at who has been accessing these services and get some sort of picture of these things. So I feel like we have some gaps in the data, but there are places that we could do some targeted outreach. So yeah, I guess I sort of feel like these principles and practices were kind of came at us, and I almost feel like we need to take a step back and really look at what's feasible for our group. What can we do? Where are the places we can even find data? Because we don't really have a ton from what I'm seeing, so yeah, those are my quick thoughts. Some of the, if you just read the statement, we will, I think this is the vision statement. I think we can get behind, we'll intentionally create spaces for respectful dialogue and difficult conversations. We will actively engage with those who feel the impact of racism more directly, seeking their input, guidance, and honoring the wisdom of their experience. This too will take a lot of effort on the part of all of us. So I think, yeah, my feeling was to, really kind of support, commend the work of Nuari. And maybe at this point, where it feels like they are still in process, not fully adopt it. And, we could say, that we're committed to this work and we need to take some time to think about how we're going to carry it out.
Yeah, so the select board has asked all the boards to adopt the Nuari vision statement. But I think there's definitely room for discussion there. And yeah, I think especially with not just for our board, but for other boards too, we all I think we all support this. But the expectations based on the language they have are quite high. And we want to make sure that we don't put ourselves in a position where we're not able to deliver on all these things that we're committing to do.
And I think we've always taken on work too that's measurable. And so that's something I want to, be sure that we are really, there's some evaluation and I don't find any of that yet in the work that Nuari's doing. They've just begun, so maybe we'll get there. But I think that's something else I
think your conversation, the fact that they don't have information on race breakdown of the kids seeking support or whatever is really interesting, right? Like it's just not front of mind. And I know right now it's mental health and support is very much like in a tailspin, right? There's so much demand and not enough support. But I think that's really interesting. I totally agree with let's not promise to do things we aren't able to do or have no control of. But it's really difficult to be given this broad set of, I wish it was a narrower framework to say yes, this will be front of mind, top of priority, right? But we can't incorporate it into necessarily every aspect of the work, or figure out what makes sense, right? Where we can really devote those resources. I don't know. Yeah, I think we need to dig in a little bit more. Are other boards adopting this straight out? I guess select board did, right?
So at least one other board, and it was the library, and Christina sent me the link to their discussion about this, and it's a really enlightening discussion. I thought, by the person who presented it, and what their board chose to do was not to endorse or adopt, but to acknowledge and commend Nuari and their work, and recognize that this is a really big thing to unpack, and it's something that's going to take some time to develop for them as well as us.
I noticed that Nuari is, they have a link on the website of, groups that have endorsed them. And so no town bodies other than the select board and the Human Rights Committee have actually adopted this. And there are some community groups who have. But yeah, I would imagine that many are in a similar position, wondering how exactly we do all of this.
So is this something we think that you guys would like to put in the same? I know Christine already said it, like support Nuari and their work, endorse and adopt what they're trying to do, but take some more time to review this, maybe have a larger time set aside for our next Board of Health meeting in June to really hammer this out? Or do you think?
Yeah, I think so. I think, I would propose for, as of this meeting, we acknowledge and commend and recognize that there's more work to be done, which we will continue to do, starting with our very next meeting. But that we wouldn't endorse and adopt as is.
I mean, is the hardest part the intentional practices? Like do we support the racial equity statement seems right? I mean, we support the guiding principles. I guess maybe I need to read it more closely, but we could just say, and then in terms of intentional practice, we will develop public health related intentional practice items or something like that.
Oh, I mean, I'd still like to know why those two people stepped down from this.
Who were they? It was the Chinese Friends of Needham rep, and who was the other one?
I don't know. There was a student and a resident who both
student,
stepped down.
Yeah, I don't know if that's public information.
Yeah, I mean, most of the language is fine. Again, I mean, I think there's some editorializing here that I just don't think is really necessary, and frankly makes me a little bit uncomfortable. I agree that we can, certainly commend them for their work, and and recognize that we've got more work to be done. But I mean, I think as all of us have outlined here, public health wasn't at the table. I think part of trying to make an inclusive statement would be to actually include everybody, and we weren't included, and there are a lot of issues here that have not been included that are specific to public health that I think we would be in a better position to commit to. And that is a lot of work, and maybe the next steps after we have some more time to consider it internally is actually to invite a discussion with Nuari, maybe a special meeting, Mr. Chair, and we wind up starting to unpack some of this from a public health perspective.
Mm-hmm.
Yeah.
Yeah, I think that's a great idea.
Okay. I mean, I think those are excellent next steps. So at this point, I'm not sure if we need to take a vote on this.
As long as you guys are, I think as long as you're okay with the support, there's no vote needed. We'll just need to put out a statement saying that the Board of Health supports the work that they're doing, and know that there's continued work that needs to be done. Draft something.
Okay.
Right. Be careful with the word support.
Yeah, on what supported. Yeah, support Nuari in their work, but not necessarily this.
Yep.
Or maybe say acknowledge.
Yeah. Oh, yeah. Yeah.
Tiffany, you could probably send it to Rob and
you, I think, yeah. Christina.
We'll do. Okay. Tim is way better at drafting those things, so I'll have him do it and send it along next week. But yeah.
Okay. All right. Great. That sounds like a good approach.
And so, should we also make a plan to actually maybe schedule a meeting with Nuari? Or we could invite them, invite one or two of their, their chair or whoever to come to one of our meetings. I don't know how you want to do it, or we could do it.
Yeah, we can touch base with Tim and see how that would work, but we might be able to invite him to one of our meetings, but.
It looks like Marianne Cooley is one of the chairs.
Mhm.
Yeah.
In fact, she is the chair. I'm looking at this here, according to the working group members.
Is there a vice chair?
I don't
Could
see
do a
one.
chairs meeting?
Mhm.
Yeah, there is. Matt Borelli is the vice chair.
I think he's listed there as select board vice chair.
Oh, sorry. Yes, you're right. Sorry. Select board vice chair. Okay. Well, I mean, I think I mean, certainly if Marianne would come or another representative from Newari
Mhm.
to our next meeting or a future meeting. soon,
Yeah. Yeah.
Depending on when we can get things scheduled. Okay. So other comments or discussion on the Newari vision statement and the Board of Health? All right, great. So we'll move on to the community health needs as part of the Children's Hospital expansion. And I'm just moving up to it here. Is there anybody who wants to either lead off this discussion or has comments?
So I wasn't at the last meeting when you guys started talking about this, but I'm pretty sure you got the background about the meeting we had with them and what they're looking for as a hospital to see what needs and need them are and what maybe some of our priorities would be. So I think we're just looking for.
Just on their slides, they say that they're planning to, are continuing efforts to provide access to a full range of integrated pediatric care services. Now, my understanding is that is not what they're going to be offering in Needham. But I think we,
right, it's more like sports.
We really need some clarity on that because, are they competing with Needham Pediatrics or are they not competing with Needham Pediatrics? Are they going to displace our homegrown providers or not? I was a little surprised to kind of see that in their proposal because they're saying in developing our proposal, and this was specific for Needham, full range. Maybe they just meant, yes, we do that everywhere, and this is part of our full range is providing the sports services here. That's probably what they meant. But as usual, you get the hospitals required under the Community Health Act to support communities where they want to go into, and they don't have the expertise to provide the services that are actually needed because it's all social determinants. And it seems like the vast majority of what we need from the CHNA and everything else we see is in mental health and substance abuse. And I don't know what Children's is going to be able to do about that. I certainly think they have some capabilities in that area. I don't know if they want to commit resources to that, though. They certainly don't have expertise in housing or food security.
I can tell you that when we did our phone call with them, and Tiffany could also remind me, but I thought they said that all their mental health services would be in their other office in Waltham. We were encouraging them, if you have them in Needham, this is a huge, we need this. And so we did push for that on our call with them. But I recall them saying something like they have the beds in the other tent in the other city. I think it was Waltham where they have their other branch. But we said that would be a huge need in Needham if you had something in Needham for mental health.
And it doesn't need to be the inpatient beds. They could just have counseling services, offices without inpatient beds.
Okay. So we did push for that.
Is it all going to be specialty clinics? Oh, sorry. Go ahead.
No, I was just going to say too that we're going to have the Metro West Adolescent Health Survey will be done this fall as well at the schools. So we'll have that data this next year, hopefully in time for when this process kind of starts to kick off a little more.
One thought I had, in terms of what, they said their focus is going to be, which is, a lot of sports related things, orthopedics, would be sort of, again, falling into the area of injury prevention, like looking at the most recent Metro West Adolescent Health Survey. Certainly bike helmet use could be improved upon significantly, especially in the middle school. So bike safety, helmets, and then, a big issue with sports, as we all know, is concussions. And I don't know if they would consider having some sort of concussion clinic as a resource available. And I also don't know how, if that would potentially step on the toes of some of the pediatricians or the hospital here. I don't think that the hospital does it. I'm not sure about the pediatricians.
They don't. Pediatricians, frankly, it might be a good idea for us to ask them for their input on this as well, so we know exactly what they are offering. My guess, just judging nationally, is that they would be happy, more than happy, to offload the post-concussion assessments if they were able to do that. But I don't know. I wouldn't want to speak for them without actually knowing what they want.
Okay, I mean, that is certainly something that's super common in sports, and the recovery can take a while.
The other area that maybe they would be interested in, that we've often pushed for but have had very little traction as a board, is, other than the injury prevention and the medical stuff, is actually promoting good healthy habits. Is this an opportunity to refresh playgrounds, to somehow encourage kids to get outside, healthy eating habits and that sort of thing?
Yeah, nutrition I think is a really good one.
And some of these fitness programs, we used to run one at Mitchell before school, things like that. But it's hard because the turnover, if you could staff this box program or whatever through Reebok, that would be great. We have a lot of professional trainers in town and things. It seems like it could be a resource to run those kinds of programs. Again, because this facility seems like it's going to be for the privileged athlete, the rich, wealthy, suburban, Uber athletes versus, they're already exercising. They're injured, but they're trying to get better. I feel like trying to get, again, and it's the racial equities to all this stuff, try to get these other groups that may not be as involved. So yeah, again, healthy fitness and healthy eating is a good one. So
can I say there are many practices, as you know, that have started behavioral health in peds, because the data shows the vast percentage of parent questions is are behavioral health related. Westwood Pediatrics, Lester Hartman, who's a Needham resident, his wife is Reverend at the Episcopal Church. He has piloted the program and now has a full behavioral health component. I was hoping that Children's would be able to scaffold the pediatric practices to start to feel comfortable in addressing those issues, having a staff person, having a warm handoff, because they're so limited with time per visit. And do that young, upstream, developing some language for those well child visits about mental health and substance from a very young age. So children and their parents, I know with my own, can feel that language is normalized, and Children's is positioned to do that. And I was really hoping, and we all had to submit something written to Tim last summer. And I feel like making that commitment to pediatricians who don't all often have the time or the resources would be huge for upstream, and then giving them the tools and language to talk about these issues. I used to be with my own kids, and they'd ask me on the form about do you still have your trampoline? There's so many opportunities to add to that dialogue along each visit, people trust and need their pediatrician. And we found they don't often ask the school counselor for a lot of reasons. So there's a national thing, healthy parenting and primary care. But that was my hope for children's. Thanks.
Thank you. Further discussion on children's? We'll obviously be coming back to this.
Yeah, I mean, it just sounds like the mental health piece is so important. I'm just looking at Sarah's email, that she sent to children's, and she said we've seen a significant increase in crisis mental health calls, substance abuse related struggles. So crisis response and substance use treatment would be beneficial. There's already been an increase in suicide rates, so any prevention work with regard to that. It seems like that's really one of the, we can find a way for them to support that work.
Yeah, we brought up too about transportation, because in order to access some of these services, some of those who can't access the services is due to transportation. So tried to really get them to think the full picture gamut about how that would work for residents.
And that's a hard
mental health piece. I also just want to make sure that we're at least cognizant that some of this is COVID related. And, I anticipate that, in the short term that may be ending, and this is a long-term commitment that Children's is going to be making. So I don't want to minimize the importance of that, but I just want to be mindful that maybe those services are actually going to decrease in need back to baseline levels, over the next couple of years.
Okay. Moving on. The next item is the Public Health Division's regulatory update policy. And I think Lynn was going to be the person to discuss that. She's not here. I'm wondering if we want to move that to the next meeting, unless either Tara or Tiffany would like to discuss it.
I think we could move it if you want, if it's something that we want to discuss more in detail. I didn't get any updates from Lynn. I asked her if she wanted me to share, but so I'm thinking we could bump it to the next meeting. Okay,
are the other board members okay with that?
Okay.
I don't really know the nature of the discussions. Maybe if we get a little context for the next meeting, we know what to look at. It's
right, that's why I thought that it would be
okay.
Best if it was, so we could discuss it with context. Okay, so we'll move that to the next one. Which brings us.
Can I add one thing about something Tiffany and Tim have been working on, and it's related to all age residents in Needham, and Tiffany can join in. Project interface through William James. Tim has been the one that has gotten funding for that program. Janice piloted the first and second year, and they have increased their rates. And this year will be $30,000 for Needham. Many of our towns registered with was Mass School of Professional Psychology and William James, and I know you're all familiar with the project, and that is the, non-acute call center with professionals or high-level grad students screening and finding clinicians based on your insurance and availability and location. So I just know that in my world, we're talking a lot about American Rescue Plan money, and they're asking us federally what behavioral health money could be used for. Massachusetts is getting a lot. And that's something that I've spoken to Rep. Garlick about. We can't sustain $30,000 a year for interface, but we're working really hard to get that funded. Years ago, it was BID and the Kyle Shapiro Foundation, and Tim and Tiffany have worked hard to continue that. They're only allowing, Margaret Hannah's constrained. So this year it's only a 1-year contract, not a 2 or 3, and it's 30,000. So I also see an opportunity with Children's perhaps, and to do that kind of a service. It's primarily used for youth, but you all have seen the posters, and Tim has had them distributed across primary care, churches, for all age residents to call. And if that goes away, when people are vulnerable, they don't have the capacity to call 5 different, therapy offices. So that's a concern. And so this year, suddenly for FY22, it'll be 30,000. It's because of the increased cost Margaret outlined, and she's meeting with 75 towns to let people know that. So I'd like that to be on your radar as well, that we have appreciated Interface, and I know you're all familiar with it. Margaret, Mary Lou Sutter's put in her plan, she knows she needs to stand something up like that, but it won't be for probably, it's sort of like the helpline, for maybe 2 years, perhaps. I'd like to see it sooner for the whole state. But that's going to be a real gap, and the costs are high. So I'd like to see some of our American Rescue Plan funds that come to each of our towns. Medfield is getting 1.2, the schools are getting their own, and then we get 2 million from the county, just my little town. We're advocating as a Board of Health to, direct some of those funds to public health and mental health. So just as an FYI, there are funds, and those funds, I'm told, can be spent up to December 2024 or 23. So they're not short-lived. So I'm just trying to make a pitch for behavioral health and that particular interface. I don't know if Tiffany wants to say anything more about that.
So yes, but not now. We have 3 minutes left on the meeting. And I know the one thing we really got to get to is the mosquito control, because if we choose to opt out of that or push that towards the town, we have to turn that in, I believe, at the beginning of June. So yeah, so we can get back to that if there's time or anybody has any questions on that.
Okay. Thank you, Carol. So yeah, the mosquito control update. Tara, I think you're listed for that.
Yep, so you got a copy of the letter that was sent out. So again, this is basically the board to have a discussion to continue to opt in or to make a change and opt out of mosquito control spraying, which includes the aerial or other conducted by the State Reclamation and Mosquito Control Board. So if you're satisfied with the current operational system that we've had, we don't need to take any action at this time. And then we'll continue to operate as usual. If there's a EEE emergency, the state can consider and possibly conduct aerial spray applications in response. But the other thing the letter notes, as you can see, is that the likelihood of a EEE emergency is quite low for the summer. So we just wanted to get the board's point of view on that.
I mean, they don't just spray, they spray if there's a problem, right?
Right.
So,
There's an emergency that
yeah.
This is what this is referring to.
Yeah. Seems like they figured out their PFAS issue. Thanks.
Yeah.
Yeah, they've been very good about this in the past, and I would just vote that we continue to endorse the current operation.
Okay. Does anybody on the board feel like we should opt out versus continue? Okay. So why don't we just continue with what we're doing? And then that moves us to CARES Act funding. We want some.
So yes, we do. So this was really just a discussion between Carol and Tim and I. Carol kind of just talked about a little bit with the other funding. Needham Public Health hasn't seen any CARES Act funding, and so do we, or how can we advocate for that funding? Because we have not seen any come to our department specifically since it's been given. So that was the main thing, is how can we advocate for that? Because we probably would need your guys' board support in getting that.
I mean, I would think one avenue would be our state and congressional representatives.
Yeah, how do you towns get CARES Act funding?
So yeah, sorry, I should have said that a little better. The town has received it. We have not. The board has not received, or the Needham Public Health has not received. So they've had it. We just have not received any from the town.
So we need to be advocating locally.
Yeah.
Right. So the select board and town manager, I would assume.
So where, I mean, are all those funds allocated for things, or is it just sitting there, or we don't know?
That I don't know. I know a lot went to the schools with the updates of the HVAC stuff, but I don't think it all did. But Tim also has not ever been approached about receiving funds.
Oh.
So yeah, that's the other process.
Yeah, it seems only right that funding that came during a pandemic for a public health emergency, that we should have some of it.
I mean, easy as contact tracers, our epidemiologists, our, COVID clinics, all that kind of stuff. I mean, we've
I
all
think,
just absorbed that.
Can I
Sorry.
Outline
interject?
the expenses that we've had above and beyond our budget that were unanticipated because of the pandemic.
Some of these expenses
At the
were
very
covered
least.
by grants.
Okay.
And Tim also mentioned that Tatiana said a lot of the submissions that we made got rejected for some reason. And by the time she found out, it was too late to resubmit.
So, but those were FEMA submissions, not CARES Act. So CARES Act wasn't, you didn't have to apply for the CARES Act. CARES Act was just given. The FEMA we have to apply to get. So those could potentially though be what we asked for CARES Act, because we did have to do, the contact tracers are not grant funded, right? So they
Are now. They're being funded by the MHOA grant.
Okay. And other submissions like Mary Fontaine, our full-time nurse who's headed all of that, she's not under grant funding, things like that, that this CARES Act funding could really help with.
Okay.
So maybe we do this as kind of put through, I'll work with Tim to maybe make a list of some things that we could utilize this for, and we can send it around to you guys and then see what more priorities we'd like to utilize, because some of these services are going to go away at the end of June, like our contact tracing, we may not need 3 by the end of June after that and stuff like that. So we can kind of work on a list of thoughts and things and then send it around and see what your guys' feelings are on what we could ask for or advocate for.
Yes, that sounds great. Please do something.
Yeah. All right. Excellent. Any other comments on that or discussion? All right, so the final item, I just thought we should quickly discuss as a board with the changing pandemic, whether we should continue to have 2 meetings per month or whether we would now be able to return, it doesn't have to be immediately, but we could pick a point at which we would go back to 1 meeting per month, with, of course, with the possibility of, having an emergency meeting if we need to, like to lift the face covering mandate or something like that. Do people have thoughts about that?
I'd agree with you, Rob. I mean, I think we have 1 meeting on the books now, and maybe we keep that, but discontinue thereafter.
Yes, I think that makes sense too.
Yeah, I'm fine with that.
Okay. All right. So that'll mean that the June COVID meeting would be our last sort of specific COVID meeting, and otherwise we would return to our regular monthly meeting. Okay. So I think that's everything on the agenda, unless there's anything else.
The July 4th discussion, do you want any quick update on that? We met with the Exchange Club on Friday, or we can table that to the COVID meeting next couple weeks.
Kathleen?
I'd love to hear what the thoughts are. Sorry, but I don't want to hold everyone up. I mean,
I don't want to hold the Exchange Club up.
Right. Well, I'm afraid, if there's a boulder rolling downhill, we want to be able to catch it.
No worries, I'll talk fast. So we met with them, Tim and I met with them on Friday or Thursday morning, and they are not going to do the fireworks. They cut down their parade to 50%. They do have certain groups. They haven't submitted their safety plan to us, which is required for parades and road races and stuff. So they're supposed to send that to us here shortly, and Tim and I will review it. But they do have things in there. They have bands, a couple of different bands. So those are where my main concerns will be, is because right now the governor's requirement with bands is members have to be 10 feet apart from each other if they're doing any wind instruments. So it'll be outside. So I don't know how much concern that is, but they say they have plenty of spacing. They have the road race in the morning that will start at 7:45 and give enough time with 3 different start times for group settings. They're requiring everybody to wear a mask at the beginning. If you can distance as you're running, you can take it off. And then as you cross through the line, you have to put your mask back on. No gatherings before or after for the road race. And then for the parade will start, I believe, at 9. And they have different start sections for each different kind of group. And then this year they do have a quiet section, which was petitioned by some family and residents in Needham because of children with auditory concerns. So for the most part, based off of what they have, it sounds very, they were very good at looking at the COVID requirements and what they can do and what they can't do and making it safe. So they won't have people on the side this year selling anything. They won't do any kind of stuff like that. So.
Well, as long as their wind instrument players are all vaccinated, or, I mean, they honestly could Binax these folks right before, if there's somebody, the bagpipe player or something, they're worried about spewing particles through the parade route. I mean, the dispersion outside, I mean, we know so great. I see it as low risk.
And I think the guidance on this is going to be changing rapidly, particularly after what CDC did yesterday. Where, I mean, they're still saying wear masks in crowded areas, and I get it, because can you really tell who's vaccinated and not? And the bans are probably going to be unvaccinated, teenagers. I mean, it would be a large part of that, is my guess. But agreed. I think we've demonstrated that outdoors is pretty darn low risk. So I look forward to to seeing what CDC finally comes around to in the near future.
And they can plan with this, and then if it's
exactly.
sure
they can relax it from there.
So keep it tight, and then
Exactly. Okay, so our next meeting is the COVID-focused meeting of May 27th at 9 o'clock. And with that, I'll look for a motion to adjourn.
so moved.
Second. All in favor by roll call. Steve?
Yes.
Kathleen?
Yes.
Christina?
Yes.
Looks like Ed is not here. Rob, yes. Okay. Thank you for your time, everybody.
Thank you all.
Thank you.
Thank you.